All right, this is our presentation, Grand Nurse Theory, Virginia Henderson by Asia. Sorry, I messed up. I'm going to restart.
No worries.
I'm sure I can edit it. Okay, here we go. 3, 2, 1. Right, this is our Grand Nurse Theory presentation on Virginia Henderson by Asia, Carolina, Damas, and Jacob. Virginia Henderson, the First Lady of Nursing. Virginia Henderson was one of the most influential nursing theorists in modern nursing history. She was born in 1897 in Kansas City, Missouri, and passed away in 1996 at 98 years old in Branford, Connecticut. She was fifth of 8 children. Her father was a lawyer and raised her and her siblings in Virginia. Once she became a nurse, she made significant contributions to the profession, including developing the idea of patient independence, and became known as the First Lady of Nursing. In 1914, World War I began during a time when women had limited professional opportunities. World War I inspired her to become a nurse because there was a need for skilled caregivers. In 1918, Henderson enrolled into the Army School of Nursing in Washington, D.C., which was one of the few programs available to women at that time. Henderson then pursued further education and received her MA in 1934 from Columbia University. Henderson transitioned from bedside care to nursing education and theory development, made her one of the most influential nurse theorists in modern history. Henderson's professional nursing experience included clinical practice, teaching, research, and writing. One of her most significant contributions included revising Bertha Harmer's nursing textbook, which is a foundational nursing textbook that is used worldwide. Additionally, while working as a research associate at Yale University, she developed the Nursing Studies Index, which is a major research tool that advanced nursing scholarship. The development of Henderson's nursing theory revolved around the idea of 14 basic human needs, which continues to influence nursing education, care planning, and clinical reasoning today.
Virginia Henderson's nursing need theory, also known as theory of human needs, focuses on helping patients do what they would normally do on their own, if they have the strength, knowledge, or ability. The main goal of this theory is to promote patient independence as quickly as possible. Henderson identified 14 basic human needs that guide nursing care. Her theory also takes a holistic approach, meaning it considers physical, emotional, social, and spiritual aspects of health.
Henderson's theory is heavily influenced by Florence Nightingale, especially the idea that environment plays a major role in patient health. However, Henderson's expanded beyond that by focusing more on the individual patient and their independence. Her worldview centers on the belief that patients are whole individuals with physical, emotional, and social needs. She introduced the concept of the 14 basic needs, which guide nursing care. Henderson also viewed nursing as both a science and an art, meaning it requires technical knowledge, but also compassion and critical thinking. The ultimate goal of nursing, according to Henderson, is to help patients become as independent as possible. Nurses temporarily step in to assist patients with activities they would normally do on their own until they regain the ability. Virginia Henderson was viewed as one of the most influential figures in nursing history. She earned the nickname First Lady of Nursing because of her lasting impact on the profession. Her work helped clearly define what nursing is and what nurses do, which was crucial in establishing nursing as its own profession separate from medicine. Her ideas were adopted internationally, including by the International Council of Nurses, and her work continues to influence how nurses are educated and how patient care is delivered today. Virginia Henderson had a major impact on nursing within the United States. She helped clearly define what nursing is and what nurses do, which was essential in establishing nursing as its own profession separate from medicine. Her ideas are still taught in nursing programs across the country, especially her emphasis on patient independence and holistic care. This helped shape how nurses assess and care for patients today. Henderson received numerous awards throughout her career. One of the most significant was the Christine Renman Prize, which is considered the highest international honor in nursing. She also received several honorary doctoral degrees, showing how widely respected she was in both academic and professional settings. Her nickname, the First Lady of Nursing, reflects the recognition she received for her lifelong contributions to the field. Virginia Henderson's legacy extends far beyond the United States. Her definition of nursing is considered universal because it focuses on basic human needs which apply across all cultures and healthcare systems. Her work has been translated into multiple languages and is taught in nursing programs across the world. Because of this, she played a major role in shaping modern nursing practice on a global scale. Her legacy is also preserved through the Virginia Henderson Global Nursery e-repository, which provides access to nursing research worldwide. This shows that her impact is not just historical, but continues to influence nursing practice globally.
Henderson identified 14 basic human needs that are essential for maintaining health and independence. These first 6 needs focus mainly on basic physical functions such as breathing, eating, movement, and rest. When patients are unable to meet these needs on their own, nurses provide support until the patient can regain independence. The remaining 8 needs expand beyond physical care and include emotional, social, and spiritual well-being. Henderson emphasized that nursing should care for the whole person, not just the illness. These needs include communication, safety, excuse me, personal growth, and learning, all of which contribute to overall health and independence. Henderson's theory aligns with the 4 nursing meta-paradigm concepts. The person is viewed as someone who may need assistance to become independent. Health is identified as the ability to care for oneself and meet basic needs. Nursing involves helping patients perform activities they cannot do on their own. Lastly, the environment includes all external factors that influence a patient's health, recovery, and independence. This diagram shows how Henderson's theory is applied in practice. The nurse identifies which of the patient's basic needs within the 14 needs are not being met and provides assistance. Through this support, the patient gains strength, knowledge, and confidence. The end goal is for the patient to become independent and achieve optimal health.
All nurses use the theory in clinical practice. In clinical practice, Henderson's theory guides holistic assessment. Nurses identify which need the patient can meet independently and which require support. This helps create individualized care plan and promote patient autonomy. It's especially useful in rehabilitation and long care setting. In nursing education, the theory provides a clear, organized way to teach holistic assessment. Students learn to think beyond physical symptoms and consider emotional, social, and spiritual needs. It also supports case studies and simulation exercise. For administrator, Anderson's theory helped shape patient-centered care, policy, and documentation system. It also supports staffing decisions based on patient dependency level and provides a framework for evaluating quality of care.
This patient case shows how Henderson's theory is applied in practice. The patient is recovering from hip surgery and is unable to meet several basic needs independently, including mobility, hygiene, and keeping themselves safe. The nurse uses Henderson's 14 basic needs to assess the patient and guide care. Interventions include assisting with ambulation, supporting self-care, and providing education. As a result, the patient improves in mobility and becomes more independent and safe, which reflects the main goal of Henderson's theory.
Simplicity of the theory. Why the theory is simple. One of the strengths of Henderson's theory is simplicity. The 14 needs are easy to understand, easy to teach, and easy to apply. The definition of nursing is straightforward and initiative. Why the theory is also complex. Complexity, however, the theory is also complex in scope. The needs span multiple domains and they interact with one another. Applying the theory requires comprehensive assessment and critical thinking. Its broad applicability equals setting ad and its complexity. Example of the theory used in nursing. One study applied Anderson's theory to proactive patients. Nurses used the 14 needs to assess independence after surgery by identifying unmet needs and totalitarian interventions. The study showed improved recovery time and higher patient satisfaction. This demonstration the theory value in research and outcome measurement. Mid-range theory. A mid-range theory closely connected to Anderson's work is RM self-care. Deficit theory. RMs focus on self-care deficit, and nursing system. Her theory explains when and why nursing is needed. Relationship between Anderson and RM. A mid-range theory closely connected to Anderson's work is RM self-care. Anderson and Oram share essential idea, the importance of patient independence. Anderson identified the needs, Oram explained, or nurses support patients when they cannot meet those needs. Oram essentially expand Anderson's idea into a more structured mid-range theory. In summary, Anderson's need theory is simple in structure but broad in scope. It guides nursing practice, education, administration, and research. It also influenced mid-range theory like ORAM's. Anderson's emphasis on independence continue to shape nursing today.
Right, that concludes our presentation on Virginia Henderson, the First Lady of Nursing.
Yay.
Thank you.
Thank you.
So recording. One second. Recording.
Perfect.
I don't know. That's still recording. Oh, there we go. Stop.